Bam, ba-da, ba.
And is your nose driving you nuts? Find out if it's spring allergies or more serious sinusitis. Our doctor's going to tell us which treatments really work.
Yeah, a lot of you need to know right now. I know that I do. If itchy eyes and sore sinuses are keeping you from enjoying this beautiful San Diego weather, hang on. We're here to help you get a handle on your hay fever and help you find out if your sneezing is maybe a more serious problem. Dr. Brian Weeks joining us from Alvarado Hospital, and you're a busy man these days.
It's definitely a busy time. Lots of patients now are starting to really get the bite of spring and deal with a lot of the allergy issues. I mean, certainly as the weather warms and the temperature changes, allergy season really hits us full bloom, and that's because of all the changes in the new plants blooming and all the different things that happen when the weather warms and changes. So I think it's important to talk about that.
I think there's a misconception. I mean, San Diego, of course, doesn't have the climate extremes as other places do, but we have a lot of folks here that suffer from allergies.
Well, it's unbelievable. We're really in a unique setting, and the things that make San Diego such a wonderful place to live also make it really difficult for people this time of year. We're really at a point where we have some humidity, and yet it's frequently very dry. The weather is warm, but it's cool at night, so we have dramatic temperature changes throughout the day. And the problem is that's great for us to sleep at night when it's cool, but it's really, really hard on our nose and our sinuses. And our nasal membranes really don't function at their best when the temperature has these wide changes, when the humidity changes, when the barometric pressure changes. So this is definitely that time of year.
You're speaking my language, baby. All right, so let's talk about allergies. Defining if they are in fact allergies and not a sinus problem. What are the signs that we need to look for?
Your typical allergy patient's going to come into your office with complaints of, doctor, my nose is very, very congested. I have itchy eyes. I have watery eyes. I really notice my symptoms mostly at nighttime. I have a hard time breathing at night, but even throughout the day, a lot of clear drainage from the nose, thick mucus at times, drainage down the back of the throat, cough, those types of symptoms. Really think about it as being, mostly related to congestion and itchy, kind of watery drainage from the nose and the eyes.
Okay, and contrasting that, if it's a more serious problem, sinusitis, how are those symptoms maybe a little bit different?
Absolutely. That's probably the most important point that patients need to understand is when you do have a serious condition like sinusitis, your symptoms are going to be somewhat similar yet different as well. You're going to have a different color of drainage from the nose. Typically it's going to be a green or a yellow type drainage. You may have an underlying difficulty with headache or severe pressure in your sinuses. You often
kind of like an elephant is standing right there on them.
Exactly, like pretend like a big elephant just sitting on the front of your head. But truthfully, and often a fever or other symptoms, muscle aches, things like that you wouldn't necessarily associate with an allergy, but that may indicate, and again, chronic sinusitis will drain you of your energy, it will give you fatigue, and it can lead to serious problems. Patients that have sinusitis need to be treated with a completely different paradigm, and I think we'll talk about both of those things here in just a minute.
Let's talk about the allergy treatments. What are some things that, as a doctor and a physician, that you find are very effective with your patients?
Well, I'll tell you, the first thing we always recommend to patients is literally just irrigating the nose with a saline solution. I always tell my patients when I'm talking to them, think about it like washing your car. When you wash your car, we all know how beautiful the car looks. It looks just great. And literally 5 minutes later, it's already starting to get dirty again. So it's not magical, but at the same time with the nose, you rinse your nose out at least once a day, every day. It's going to start getting more allergens and things in it immediately afterward, but it's certainly going to be clean every day. That's the first thing. Second thing to do is to consider an evaluation, either with an allergist or an ear, nose, and throat specialist like myself, where we would do allergy testing and run a patient through appropriate tests to determine maybe what they're allergic to.
Okay.
And then we have a bevy of medications available, topical anti-inflammatory sprays, antihistamine sprays, and a whole gamut of medications that are aimed at treating underlying allergies.
Okay, now for treating sinusitis, I think we have some graphics that we want to pop up because that's a different way to try to cure that.
Completely different. When you talk about sinusitis, you're dealing with issues that are really serious medical problems. We always, again, use medications as first-line therapy, things like antibiotics. We use a lot of the same medications, topical nasal sprays, even antihistamine decongestants. But again, when people don't respond to medications and they have underlying infection, then we talk about different procedures. We have a number of wonderful minimally invasive new procedures available to treat sinus problems, balloon sinuplasty, a number of traditional techniques that we use, and those are wonderfully effective, treatments that we can do with rapid recoveries compared to traditional surgeries. Again, the key is differentiating allergy versus sinus infection.
And you can help patients pinpoint that.
Most definitely.
And one thing I thought it was so interesting, I had an experience where I had crazy chronic sinusitis for a long time. Somebody told me, because I had TMJ, tension in my jaw, that doing physical therapy could alleviate that. I didn't believe them. I tried it. It's gone, and I swear to you, I really haven't had problems since.
I'll tell you what, temporomandibular joint dysfunction, or TMJ as we all know it, can be an incredibly uncomfortable situation. It can lead to referred pain, headache, pressure, things like sleep apnea. There are so many other conditions that we treat as ear, nose, and throat specialists that can mimic sinusitis or headache and pressure. So things to consider. A proper evaluation for those types of symptoms is warranted. I want to encourage all the patients, as you have, to just really seek appropriate medical advice, and then we can sort of get a handle on what the symptoms are telling us.
Right, because an elephant sitting right on your face, I mean, it's not fun any time of the year.
It's not what the doctor recommended.
No, or ordered. All right, Dr. Brian Weeks, Alvarado Hospital, pleasure to have you on today.
What a pleasure. Thanks for having me here.
Good health to you.